name's Lauren Huff. I'm a nurse in the Weber State Nursing Program, and I'm work at Ogden Regional Medical Center. This is my husband Tanner. He's been a good sport in letting us do this head-to-toe assessment on him. Before we start the assessment, I just want to wash my hands. And we've already completed a health history, a family history, medical history, a neuro exam, an eye exam, the swollen test. We've taken his vitals, his height, his weight, and yeah, so let's just get started here. So the first thing we want to assess is if he is alert and oriented. So what's your name?
Tanner.
And where are we right now?
We're in our office.
Perfect. And what is the day?
It's Monday,
And what year is it?
2019.
Awesome. And what are we doing here?
Just doing a full body assessment.
Awesome. Okay, and then we're going to start with the cranial nerves. So the first cranial nerve we're going to assess is the smell. So I'm going to have you plug one nose and close your eyes. And I'm going to have you tell me what is you're smelling.
Pumpkin.
Awesome. And then close your eyes and plug the other nostril. Perfect. And what are you smelling?
Apples.
Awesome. The second cranial nerve is the vision test, which we've already completed. The third, fourth, and sixth have to do with vision as well. So I'm going to have you follow my finger. Perfect. And then cross-eyed. Awesome. And then follow my nose out and out. Perfect. And I don't have a pen, but pretend this is a pen. We would block and shine a light into the eye to check for the pupillary reaction. We want both to react the same, and you can test the other one too. Perfect. And then just blink a couple of times, let your eyes react. And then we would just check for the eyelids as well. The fifth and seventh cranial nerves is the face. So I'm going to have you scrunch your face for me, blow out your cheeks, smile, frown, and we would check for wrinkles too. You can also assess if he can fill on his face. So tell me, close your eyes and tell me where I'm touching.
Down my forehead.
Perfect.
Down my cheek.
Perfect.
Down the other cheek. On my chin.
Perfect. And this is a good time too, while you're checking out the face, is to check for facial symmetry too. You don't want any drooping or anything like that. The eighth cranial nerve is the ears. We don't have any of the tools as well, but one way we can test is having him close his eyes and plug one ear. And then tell me what I'm whispering.
Snow.
Perfect. And then the other one?
Winter.
Perfect. The ninth, 10th, and 12th cranial nerves have to do with the mouth. So stick your tongue out and say, "Ah" for me. Perfect. And then I'm going to touch the side of your cheek, and you're going to push your tongue against it to check for tongue strength. Perfect. And the other one? Awesome. And then you could get your little flashlight out and check in the mouth open, please. You can check the tonsils, you can check the teeth, the mucous membrane, make sure they're nice and pink, check the tongue, anything like that. The last cranial nerve is 11. It's checking for shoulder and neck strength. So I'm going to have you lift up your shoulders. Perfect. And then just turn your neck side to side. Awesome. Perfect. So that covers the basic cranial nerves. We also want to check the cerebellum and balance. So I'm going to have you stand up for me. We're going to push this chair back so you can stay in the view. Yeah, perfect. Okay. So first thing is just take a couple steps forward. Awesome. And backwards. And we're just assessing gait right now, his ability to walk and to balance. I'm going to have you go on your tippy toes and down. Perfect. Stand on one leg and bring your heel down your shin. Perfect. And then the other one, heel down your shin. Perfect. And then go ahead and stand on one leg. Put your arms out and touch your nose. Perfect. And the other one. Great. Perfect. Obviously, with an elderly adult, you would want to make sure that they're not at risk for falling, so being close, watching if they're going to fall. Another way we can test for hand strength is going like this and balance. Perfect. And then we want to also assess for scoliosis at this time. So I'm going to have you walk heel, toe for me. Perfect. Awesome. Alrighty. And while you're standing, I'm going to have you turn around and we're just going to assess your spine. Perfect. So you can feel the vertebrae down, and then you can also assess the kidneys for any pain associated with the CVA point. Perfect. Awesome. Thank you so much. So you can go ahead and sit back down. Okay, we're going to continue with the head assessment. You would just want to assess the skin, the scalp, the hair, make sure it's equal all around, check for any like lumps, bumps, bruises, open sores on the scalps, any lice, anything like that. His skin looks good, it's nice and pink, nice and warm to the touch. You could assess for any moles on the skin too. You can check out the ears, look inside, make sure it's like a purely pearly white, no drainage coming out with your little flashlight. We already did pretty much an eye test and a mouth test with the cranial nerves. The other thing we can assess is for deviated septum, so have you blow out of one nostril and the other one. And you can also look with your light to assess for like any drainage or anything like that too. Perfect. Moving down. Oh, I forgot with the mouth. Cranial nerves 9, 10, and 12. That we want to assess the swallow. So we'll just go back to that really fast. Just take a sip and I'm going to assess your swallowing. Perfect. You can watch the trachea. And then you could also take the tongue depressor and have them do the gag reflex too. So I'm not going to gag him that way. Perfect. So then continuing down the neck, you can feel the trachea. You can feel the thyroid in there. You can check for the carotid pulses on both sides. Great. Perfect. Moving down with the pulses, you can check the radial pulses too on each side. You could also do femoral, which we're not going to do. You can do the popliteal. And then if you want to put your foot up for me so I can show her, you can do the dorsal. Hopefully you can see. And then you want to do the pulse too. And you'd want to do that on both sides. And then the reflexes, while we're down here, we can do the tricep reflex. So you're going to put your arm like this, relax, perfect. And you'd want to tap right here with your little tool that we don't have, and it would reflex. Then you can do the brachial ones, and you would tap right here and it'd reflex. And then you can do the radial too, tap and his arm would reflex. You'd want to do that on both sides. And then moving down, you can do the knee one, tap both. And you can also check the Achilles reflex. It's hard to tell, sorry, we don't have the best setup here, but you would hold his foot, it would be like obviously down, and then you could tap the back and his foot would do a reflex. Perfect. While we're here, we want to assess for any like jugular vein distension. You want to assess for any like edema in the body, in the feet, a general skin assessment while you're going down. Any open sores, you can check for Homan's sign. Have him push up and see if there's any pain associated in his calf for DVTs. And then you can do clonus, is where you have them put their foot out, relax it, and if it rebounds, then that would be a positive clonus sign. So you want to assess for that too. Perfect. So going back down, we're going to go back to kind of the thoracic area. We're going to listen to lung sounds. For lung sounds, you want to do the 6 on the front, 6 on the back. So kind of in an outward motion, maybe face the camera, perfect. In an outward motion like this, you want to listen for a minute to 30 seconds. And then you'd want to do the same on the back. So for time's sake, I'll just show you the positioning. Take a deep breath for me. Take a deep breath. Perfect. And then on the back, maybe turn to the side so she can kind of see. Perfect. You're just going to assess like here, 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 down, and the same on the other sides down there. Okay, great. The next thing we want to move to is the heart sounds. So we're going to do all 5 points. So we're going to do aortic, pulmonic, herbs, tricuspid, and mitral. The aortic and pulmonic are in the 2nd intercostal space. Herbs is in the 3rd, tricuspid is in the 4th, and mitral's in the 5th. And you want to listen for a full minute to check for any abnormalities in the heart rhythm, any murmurs, stuff like that. Okay. Let's see. The next thing we're going to check for is strength in his upper extremities. So I'm gonna have you put your hands out for me, just straight out, and then resist me. Perfect. And then grab my fingers. Perfect. And then you'd also want to check for strength in the lower extremities too. So just like stick your feet out straight and then resist me. Perfect. Great. All right, so the last portion of the assessment, what we're going to do is have you laying on the ground. So we'll just move the chair and then maybe go back as far as possible. Perfect. Okay, so for the assessment, you want to inspect first before you touch anything. You don't want to see any like lumps, bumps, bruising. You want it to be like flat, non-distended. So inspect everything first. The next thing that you want to do is listen. So you want to listen to the 4 bowel sounds. You want to listen for about 5 minutes to check that they're normal and not hyper or hypo. So I'll show you the positions on that. Okay, and then the next thing you can do is percuss. This is an advanced assessment skill. So you can just tap the 9 areas of the thorax. And then the next thing you can do is a light palpation first, and you want to ask the patient if there's any pain associated with this palpation. So you want to do one hand, and you're just going to go through, lightly press on all 9 regions of the abdomen. After that, then you can do a deeper press down. You could use 2 hands for this. While doing that, you want to feel for the spleen and liver, assessing if they're enlarged and any complications with that. And it all looks good. At this point, your head-to-toe assessment is complete. You just want to ask the patient if they have any questions, concerns, anything else we need to assess, and that's all.